Hi, Marcy Swift here. We're talking about manual therapy in this video clip, and we'll specifically cover joint mobilization and manipulation. So again, as review, we finished the objective exam testing, and now what? That's the question you ask yourself, now what? So let's go through this image again just to review our process of recognizing clinical disorders. Remember, your first step in determining intervention is to bring back to the forefront of your mind your assessment. What is your working hypothesis? And so, again, in developing this hypothesis, you go through different stages of your examination. You first gather the body chart, information about the body chart, and establish several different hypotheses that could be the source of pain. Once you have created a list of hypotheses, you can complete your subjective exam by being intentional about the questions you ask in order to help you modify your hypothesis and rank order these different areas that you are predicting could potentially be causing or contributing to the patient's pain. Then you move into the objective exam and select tests, again intentionally, to help you further modify your hypothesis. You're either ruling in or ruling out different sources of pain. And then finally, treatment is going to be the last part of this process that will help you close the loop on your clinical decision making and help you to establish if you are on the right track with your hypothesis. So when we think about treatment in this clip, we're focused on manual therapy, specifically joint mobilization and manipulation. So once you've reviewed your assessment, your PT diagnosis, you want to make sure you have at the forefront the patient's end game. That's your what you're working towards. So everything that you select needs to be pointed in that direction. So that's consists of the patient's goals, participation limitations, and activity limitations. Third step is to consider contraindications. So the next few slides here, I want you to review the contraindications for joint mobilization and manipulation. So just read through these as you read through your handouts. There are several slides that outline different contraindications that you want to consider before applying joint mobilization or manipulation. And then you'll get to the slides that cover contraindications specific to soft tissue mobilization. And then finally, you'll have precautions or contraindications that you want to consider when you are applying neurodynamics or neural flossing as part of your intervention. So read through those slides and then pick back up here at step 4 in the process of determining the focus of your intervention. So is your focus to relieve the primary impairment? Is your focus to relieve movement issues within the adjacent body segments, or is your focus to address global issues? So when you're selecting manual therapy, your focus in both the primary impairment area and also the adjacent segments that might be contributing to the patient's pain is to restore or to decrease pain and improve mobility. So that would be a reason to select manual therapy. So again, always consider your working hypothesis as you select your manual therapy, along with the patient's end game and your focus of intervention. And so the question you'll ask yourself is, what manual therapy interventions will address the patient's body structure and body function impairments? And when you're looking at manual therapy, the things that you need to consider are the patient's location of symptoms. So go back to the body chart and review that. And then also, what did you find in palpation through your objective exam testing? So let's specifically talk about joint mobilization and manipulation. If your focus of intervention is to relieve pain of either the primary impairment or the adjacent tissues, then you are going to first want to choose a least painful technique. Your speed needs to be low, and it'll be a shorter treatment duration of about 1 to 2 bouts at about 15 to 30 seconds. The patient should be relaxed and comfortable, and you want to start treating them in a position of comfort, not necessarily the test position. Initially, the mobilizing technique should be non-provoking. The mobilizing technique should be removed from the symptomatic area, and oscillatory mobilizing techniques are used as opposed to sustained techniques in the resistance-free range. So that includes grade 1 or 2, and that you would select for that. If your focus of intervention is to improve mobility and also secondarily improving pain because you're improving the mobility of the joint, then the initial mobilizing technique will need to be into some resistance. So again, your grades 3s, 4s, or 5s would be the techniques you would select for that. You may begin treating at the most painful level. You'll use more of an end range technique, and the vigor will be more depending on the patient's ability to tolerate that. And the speed also can be quicker. And to dose that, you'll select 3 to 5 bouts for about 45 to 60 seconds. And just as a note, the neurodynamic techniques may go from 60 seconds to 3 minutes. So that's a little different. So how do you select a joint mobilization manipulation technique? Well, first look at the area of pain. If they have central or bilateral pain, then consider using central PAs, rotation mobilizations, and axial separation in neutral. If they have unilateral pain, then you'll want to consider unilateral PAs, rotation, axial separation, inflection, and extension. And so you might kind of have questions of why would we use rotation for bilateral symptoms, and that would go back to you thinking through your source of pain. So somebody, for example, who has a discogenic source of pain, the disc is a bilateral structure, may be causing unilateral leg pain, but at some point you may need to use that rotation technique to aid in healing of that tissue. Then the next thing to consider is the effective use of the technique. Central PAs, you're going to want to treat the stiff segment. With traction, distraction, or axial separation, you want to treat with the painful side up. With the unilateral PAs, up glides or down glides, you'll treat on the painful stiff side. And with rotation, you will treat with the painful side up first. And with transverse pressures, you'll treat towards the side of pain. So your hands will be on the opposite side of the patient's spine, pushing towards the side of pain during that technique. Consider the level from which symptoms arise. So if the symptoms are arising from the upper lumbar spine, techniques to pick would be central PAs, transverse pressures, and unilateral PAs. If the symptoms are coming from the lower lumbar spine, consider central PAs, rotations, unilateral PAs, and traction. So progress of your intervention, for somebody who is irritable, you'll start with gentle oscillations for 15 to 20 seconds. You'll reassess your OE asterisk and progress your time. Amplitude of the technique can be increased. You can repeat the technique with the nervous system in more tension, and then you can apply the technique closer to this area of pain once things progress. A non-irritable patient, the starting technique can be performed longer, so you can sustain the hold sometimes for 10 seconds. You can increase the duration. The technique can be performed with other components in different positions, and the technique can be performed closer to symptoms. In the next clip that you view, I will review soft tissue principles.